Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Osteoarthritis. Okay, in osteoarthritis, actually, there is involvement of in osteoarthritis there is involvement of distal interphalangeal joint is involved, proximal interphalangeal joint is involved, first metacarpophalangeal joint, actually first carpometacarpal joints are involved, cervical vertebrae is involved, with lower lumbar vertebrae is involved, hip joint, knee joint, and also first metatarsophalangeal joints are involved in osteoarthritis. So in the distal interphalangeal joints, there is bony enlargement occurs in the distal interphalangeal joint, and this distal interphalangeal joint bony enlargement is called as Heberden's knots. Then, in the proximal interphalangeal joint, bony enlargement in proximal interphalangeal joint is also called as Bouchard's nodes is the bony enlargement in proximal interphalangeal joint. Bony enlargement in distal interphalangeal joint is called as Heberden's knots, whereas bony enlargement in the proximal interphalangeal joint is called as Bouchard's nodes. And one important thing in osteoarthritis is there is pairing of metacarpophalangeal joint, and the wrist joint is paired in osteoarthritis.
thank you and thank you for watching.